Hello, welcome back. Today we're looking at a very important topic, which is the shoulder joint. And my focus today in this video is to teach you how to write essays. When you're asked to write essays about the shoulder joint, how to form outline, and other interesting mnemonics that can help you remember all you need to know about the shoulder joint. Our question today will be describe the shoulder joint. What factors contribute to the stability of the joint? This can be a question that can be asked in your anatomy exams. So I'll be teaching you how to write about the shoulder joint and with interesting mnemonics. The first mnemonic here is I talk about rules. This mnemonic will help you form outline if you're asked to write an essay. So this I talk about rules can help you form an outline when you're asked to write an essay about any joint in the body. So today we'll be applying this mnemonic to the shoulder joint. I for introduction, T for type of joint, A for articulation surfaces, L for ligaments and bursa, K for kind of movement, R for relations, O for blood supply, S for clinical correlation and summary. Now when you ask to write about an essay, the essay must start with an introduction and end with a summary. Now for introduction, the shoulder joint is a synovial ball and socket joint that provide the widest range of movements of any joint in the body. It is crucial for upper limb mobility, but it is prone to dislocation due to its shallow socket. Now the type of joint, it is a synovial ball and socket joint. Now for articulating surface, it is formed by the head of the humerus and the glenoid cavity of the scapula. We also have the glenoid labrum, which is a fibrocartilaginous rim that deepens the surface to improve stability. The next is a diagram showing the articulating surface of the shoulder joint. Whenever you're asked to write an essay about the structure in the body, it's always important to know how to draw and label the diagram of that structure as. So when you ask to write an essay about the joint, it is important to learn how to draw and label the joint. The next is L, which is the ligament and bursa. The ligaments seen in the shoulder joint include the glenohumeral ligament that reinforces the anterior capsule, the coracohumeral ligament that strengthens superiorly, the transverse humeral ligament that holds the long head of bicep tendon in place, and the coracoacromial ligament that forms an arc preventing superior displacement. Now this is a diagram showing the different ligaments seen in the body, while the coracoacromial ligament, the glenohumeral ligament, and the coracohumeral ligament. Here's a mnemonic that can help you remember these ligaments in the body, and the mnemonic is can the giant gorilla clamp? Can the giant gorilla clamp? The C for coracohumeral ligament, T for transverse humeral ligament, G for glenohumeral ligament, the other G for the glenoid labrum, the last C for coracoacromial ligament. The bursas seen in shoulder joint include the subacromial bursa that reduces friction between the supraspinatus tendon and the acromion, while also the subscapular bursa that is seen between the subscapularis tendon and the scapula, also the subdeltoid bursa, the subcoracoid bursa, and so on. So these bursas helps reduce friction during movement. Now, here's a mnemonic that can help you remember some of these bursas. Some shoulder slide, which is subacromioid, subdeltoid, subscapular bursas. Now, here's a diagram showing the different bursas seen in the shoulder joint. We can see here, we can see the subacromial bursa and the subscapular bursa. We can also see the subcoracoid bursa. Now, the kind of movement for K, the shoulder allows the wide range of movement. We have flexion and extension. We have adduction and adduction, which is A, abduction and E, deduction. We have medial and lateral rotation. We have circumduction. You know that flexion and extension is rising and lowering of the arm. Adduction and adduction is moving the arm sideways. Medial and lateral rotation is turning the arm inward and outward. Circumduction is the combination of the movement forming a circular motion. Here's the muscles that helps in the different movement of the body. When you're asked to write about shoulder joint and you get to the kind of movement, It's important to know one or two muscles that helps in the different kind of movement. You mustn't know all the muscles, but it's better to know one or two muscles. It is also important to know the main muscles that helps in a particular movement in the joint, because this can be asked in your multiple choice questions. For our flexion, we have the scapular head of the pectoralis major and the anterior fiber of the deltoid as the main muscle for flexion. Extension or the posterior fiber of the deltoid and the latissimus dorsi. Adduction, we have the pectoralis major and the latissimus dorsi. Abduction, we have the serratus anterior, also have the upper and lower fibers of the trapezius. Medial rotation or the pectoralis major, anterior fiber of the deltoid, latissimus dorsi, and teres major. For the lateral rotation, we have the posterior fiber of the deltoid, intraspinatus, and teres minor. The next is R, which is relations. The relation of the shoulder joint include anterior relation for pectoralis major, subscapularis, and coracobrachialis, axillary versus brachial plexus. Posterior relations infraspinatus, teres minor, supraspinatus. Superior relations acromial, coracoacromial ligament, and deltoid muscle. And inferior relations axillary nerve, posterior circumflex femoral artery. Now, yes, in mnemonic that can help you remember some of these relations of the shoulder joint, and this mnemonic is PAVED. P for posterior cuff, which is inferior spinatus and teres minor. A for anterior, A for axillary versus. Other anterior relations include pectoralis major and coracobrachialis. I for inferior axillary artery. D for deltoid that covers the superior aspect, forming the superior relations. Now the next is O, which represents the blood vessel. The blood vessels that supply the joint include the anterior and posterior circumflex femoral artery, the branch of the axillary artery, the suprascapular artery from the thyrocervical trunk, and the subscapular artery. The vein that drains this joint include the axillary vein and the cephalic vein. Then the nerve that innervates the joint include the suprascapular nerve, which is from the upper trunk of the brachial plexus, and the axillary nerve, which is from the posterior cord of the brachial plexus. Now, here is a mnemonic that can help you remember the blood supplying the shoulder, and this mnemonic is PASS. P for posterior circumflex femoral artery, A for anterior circumflex femoral artery, S for suprascapular artery, and finally the second S for subscapular artery. Finally, we have the S, which is clinical correlation and summary. For clinical correlation, it's important to know one or two clinical correlation of every structure you're asked in anatomy. You don't need to cram or memorize, just know one or two, and it will fetch you 3 marks in your exam when you're asked for it about any structure in the body. For clinical correlation, we know about the dislocation, and through dislocation is most common, often affecting the axillary nerve. The rotator cuff injury, the supraspinatus is the most common in rotator cuff injuries. For frozen shoulder, it is the progressive loss of movement due to fibrosis of the joint capsule, and it is also called adhesive capsulitis. Now for impingement syndrome, this is the compression of the supraspinatus tendon under the coracoacromial arc. The next is the summary. Shoulder joint provides exceptional mobility, but at the cost of stability. So it relies on dynamic support from the rotator cuff muscles, ligament, and labrum. So understanding anatomy is essential for diagnosing and managing shoulder injury effectively. Example, this summary can also be that the shoulder joint helps in the mobility of the upper limb, and it is a very important joint in the body. It's enough to form the summary. So you did not need memorizing a lot of things when you want to write about a summary. Knowing one or two functions of the structural acts can help you form the summary. Now moving on to the stability, we say that the shoulder joint is very mobile, but the mobility of the shoulder joint is at the cost of the stability. So there are structures that helps to stabilize the shoulder joint to prevent dislocation. So when you're asked to write about the stability of any joint, it is very important to have the following things in mind. And here's a mnemonic that can help you have those things in mind. This mnemonic is MOLT. muscles, articulating surface, ligament, and tendon. You ask yourself, are there any muscles surrounding this joint that helps in stability? The next is the articulating surface also supporting the stability of the joint? The next is the ligament. Are there ligaments surrounding the joint that provide stability for the joint? The next is tendon. Are there tendons in this around the joint that provide stability for the joint? Now for the shoulder joint, here are some structures that help in stability. The one is the rotator cuff muscles. The rotator cuff muscles surrounds the shoulder joint, attaching to the tuberosity of the humerus, and the resting tone of the muscles help to compress the head of the shoulder joint into the glenoid cavity. The next is the glenoid labrum. The glenoid labrum is a fibrocartilaginous ridge around the glenoid cavity. It deepens the cavity and creates a seal with the head of the humerus, reducing the risk for dislocation. The next is the ligaments. The ligament acts to reinforce the joint capsule and it is formed. The ligament acts to reinforce joint capsule and forms the coracoacromial arc. Finally, we have the bicep tendon. The bicep tendon acts as a minor humeral head depressor, thereby contributing to the stability. So whenever you ask about the stability of a joint, always remember mouth, muscles, articulating surface, ligaments, and tendon. So yes, a mnemonic that can help you remember the stability of factor that contribute to the stability of shoulder joint. I have two mnemonics. The first is rotator grip locks balance. Rotator grip locks balance. R for rotator cuff muscle, G for glenoid labrum, L for ligament, B for bicep tendon. Now the next mnemonic is glad, can help you know the factor that increase stability to a joint. We have the glenoid labrum, of the ligaments, of the adhesion formed by the glenoid labrum. And finally, we have the deltoid and the rotator cuff muscles that maintain the dynamic stability. I know this mnemonic have helped you, and with this mnemonic you can form an outline. The other mnemonics in this video that can help you remember all you need to know about the shoulder joint. If this video have helped you, I want you to like the video, I want you to share, I want you to subscribe, I want you to click on the notification bell so that you get notified when I drop content that will really help you as you progress in studying anatomy. Thank you for watching.